Okay, let's unpack this. You know how some amazing ideas, some really effective programs just seem to, well, fizzle out in the real world?
Hmm.
Like trying to launch a vital public health initiative, maybe suicide prevention, only to find it hits these sort of invisible walls.
Yeah, absolutely.
You've probably grappled with why even the best intentions sometimes fall short in these really complex settings.
A huge challenge.
So today we're doing a deep dive into that why for you, focusing on the incredibly critical area of suicide prevention.
And what's really fascinating here, I think, is how often the answer isn't just about the program itself, but it lies in the subtle, often overlooked context surrounding it.
Right.
We're drawing from some important new research by Krishnamoorthy and colleagues, published in 2025. It really shines a light on these hidden factors influencing complex suicide prevention efforts.
And this study uses a framework called EPIS, right, to
Mhm.
kind of map the whole journey.
Exactly, EPIS.
Mhm.
It helps understand the life cycle.
So what does this deep dive into context actually reveal about making these vital programs succeed and maybe more importantly, last?
Well, suicide prevention is, there's no doubt it's a profoundly complex global health challenge. Tragically, it claims hundreds of thousands of lives every year.
A staggering number.
It really is.
Hmm.
And while we're getting better, developing more interventions backed by solid evidence, the real hurdle isn't just if they work in, say, a controlled lab setting.
Uh-huh.
It's how they get adopted, how they're actually delivered and then sustained across all these diverse, messy, real-life settings.
So it's about the implementation reality.
Precisely. And this study actually helps broaden our understanding of what evidence even means here. It's not just efficacy evidence like does it reduce symptoms.
Right.
It's also about the evidence of successful implementation within its specific, unique context.
So how did they get at that? Did they just look at numbers?
No, and that's key. They went deeper. They actually spoke with 16 stakeholders. These were people on the ground, leaders, project managers, and crucially, advocates with lived experience.
Wow, from different places.
From around the world, yeah. Giving it that global perspective.
Yeah.
And they use that EPIS framework you mentioned.
Which stands for?
Right. Exploration, preparation, implementation, and sustainment.
Got it. Like a roadmap.
Exactly. Think of it as a life cycle roadmap for how any new program gets introduced, adapted, delivered, and hopefully kept alive long term.
And what jumped out from those conversations? What were the big findings?
Well, the findings were incredibly insightful. A lot of the significant challenges consistently, they stemmed from the outer context.
Outer context, meaning?
Basically everything external to the program itself. Things like pervasive mental health stigma in the community.
Yeah, it's a big one.
Huge. Also, glaring gaps in existing services, problems with data quality, even the specific regulatory environment of a country, all these external things.
So things outside the program's direct control, almost.
To a large extent, yes. And as one participant described it, these factors could create a real lack of receptivity to a new program on suicide prevention. It's like trying to build on unstable ground.
Okay, so that's the outer world affecting things. What about the inner workings within the organizations running these programs?
Good question. They found barriers there too,
Sure.
especially during the implementation phase. This is the inner context.
Like what kinds of things?
Things like inadequate staffing, just not enough people, or lack of resources, funding, materials.
Practical stuff.
Exactly.
Yeah.
And even the struggle to simply maintain fidelity to the intervention's original design.
Meaning sticking to how the program was supposed to be run.
Precisely. It just shows how many different moving parts, both inside and outside, need to align for success.
It sounds incredibly complex.
It is. But here's where it gets really interesting, and maybe offers the most hope. The study strongly highlighted something called bridging factors.
Bridging factor.
Yeah, and these were seen as absolutely crucial facilitators all the way through, from exploration to sustainment.
Okay, what are they?
They're essentially the relational ties, the partnerships that connect that outer community context with the inner organizational context.
Ah, connecting the two worlds.
Exactly. Think strong interrelationships between different groups, real support from existing networks of stakeholders, and this is key, a genuine willingness from the community to be partners, not just recipients.
That feels important. Community as partners.
It's huge. One participant actually described how the community became a partner by actively giving space, physically and metaphorically, which really transformed their ability to sustain the program.
That's a powerful image, giving space. So practically speaking, what strategies did the study point to for building those bridges and making these programs work?
Well, it highlighted things like consciously building strong coalitions, what they call network weaving, actively connecting different players,
Okay.
and also the critical importance of tailoring messages. You can't just have one script.
Right, one size doesn't fit all.
Definitely not. An implementer actually shared, and I'm quoting loosely here, we might have the one core message,
Hmm.
but we might tell it 4 or 5 different ways to suit different audiences, different parts of the community, making it resonate.
Makes sense. Anything else on making things stick long term?
Yes, they definitely touched on the sustainment phase. And the finding was, well, it's often overlooked.
Why is that?
Partly because so many interventions are project-based. They come with limited short-term funding. The money runs out, the project stops.
Ah, the project cycle trap.
Exactly. The ideal scenario, as the study points out, is for an intervention to become embedded, to become just the way we do business within routine care or community structures.
So it needs strategic, long-term funding.
Yes, and continued support from policymakers. It needs to be seen not as a temporary fix, but as part of the essential infrastructure.
So wrapping this up then, this deep dive really seems to show us that understanding and, more importantly, actively addressing the context, especially by building and strengthening those crucial bridging factors, is just paramount.
Absolutely paramount, especially for complex interventions like suicide prevention, if they're truly going to succeed and endure.
It's not just about having a good program, it's about making it fit and connect.
Precisely. And this really raises, I think, an important question for you listening right now. How might actively looking at these outer context barriers and intentionally nurturing these bridging factors help you navigate or implement complex initiatives?
Whether that's in your professional work.
Or even in your personal life, perhaps in community volunteering or advocacy, it's a really powerful lesson, isn't it? Looking beyond the obvious intervention itself to what truly surrounds a challenge, because that's often where you find the path to lasting impact.